have you updated us on the hospital grant program yet? Did you?
I hate that Senator Hobson left.
Okay, so can you please let us know?
Yes, sir. Would you like now or later?
Sure.
Okay. A wonderful idea, a very smart thing to do. Unfortunately, we picked the wrong pot of money. And the problem we're having, everything in the statute is legal, using the ARPA funds is legal, tying the two together has been a unique challenge. And we have been working hard with Liz Welch's team. Horn CPA Group, as you know, does their ARPA compliance. HRK works with us, and all of us working together have done every wraparound we know to improve the number of hospitals that will qualify. And we just run into a sticking point of the language in the statute, which ARPA funds must follow, requires that there be negative impact demonstrated. And with the auditors reviewing all the financials, 2/3 of our hospitals have applied. Out of that, a third qualify for significant need. The total loss was about $500 million, but that's all wrapped up in a third of the hospitals. A third had balanced books, mainly because of specific federal grants that satisfied their need, which eliminates them from ARPA, and then a third haven't applied. And I know what legislative intent was, and right now we can't get to legislative intent with ARPA funds, so I'm having to come back to leadership and present the options, and we'll have to have direction. We've done all the work, but it's just we've got a couple of decisions to make.
Let me be clear: Are you
Yes, sir.
announcing to the public today that the hospitals, as it stands now, are not going to be awarded these funds we put in place?
We have a third of the hospitals who qualify at full levels, and then some, and then a third that applied who won't meet the ARPA criteria, and then this is what's handed to us.
Has this been made public yet?
We have been talking to all the stakeholders, and I have.
Do the hospitals know this yet?
I have been talking to the hospital leadership. Yes, sir. I've been talking to the CEOs one by one as they are contacting me and walking everybody through it. Most everybody knows the challenge, and the statute was written, as I understand it, with the expectation of state resources, and then with the decision to use ARPA is where the compliance issue comes in.
The ones that you said do comply or are eligible, I think you said, have they received their money yet?
There's a big decision that needs to be made from the leadership to give us direction. We are demonstrating who is going to qualify.
The leadership. Do you speaking to legislative leadership or somebody else? The governor's office. I mean, who are we talking about?
To really all of y'all.
Okay.
And understand, Mr. Chairman, this is not a health department decision. This is what's being handed to us.
Let me ask you this.
Tell what we can do.
I'm sure y'all were involved, and there was no secret that we were working on back during the session.
Yes, sir.
Providing this help for our hospitals.
Yes, sir.
Did anybody from your agency tell or communicate to the legislature that these problems that y'all are now saying before the bill was finalized?
Yes, sir. We gave input regarding the difficulty of ARPA funding. And, in terms of a quick rollout, I don't think anybody was expecting the compliance issues that are being brought to us by Horn and HRK, who do all the ARPA compliance for the state. And I know DFA gave input. We knew it wouldn't be a quick rollout with ARPA, just from our experience with ARPA. what we're running into was not foreseen by anybody in terms of what we're being told we can do with ARPA funds.
So just getting down to practical and common sense, what I'm hearing you say without getting into the legalities or the specifics of the legalities,
Yes, sir.
is that the hospitals who were more affected by any industry by COVID are not eligible or having difficulties, can't receive the financial help that was provided to the states to help for COVID.
With the program as it was designed and the ability to use the ARPA funds, again, this is what we're being told. This is not what we're figuring out. We're being told what we can do with those dollars. And I know it's not in compliance with legislative intent, which is why I need further direction.
I understand you're the messenger on this.
Yes, sir.
I can see that. But
Yes, sir.
I mean, we're here, we're ready to hear because our hospital, I'm hearing from mine. I know people are hearing from theirs. Where's the money? Are you telling us, this body, that there needs to be a fix to the statute come January? Or before that,
There are a few.
necessary?
Yes, sir. We have a few options there. We see a way to eventually fund, all the hospitals if that's y'all's desire. We're being told we can't do it with that 103, but we can show you the option. If you want to use ARPA for all of them, we can show you how to do it.
You understand that when we passed this bill back and worked on it all session, the chairman, the House side, public health chairman's not here, but I know from while I was in the room many times, there was a sheet that every legislator was provided. This is what your hospital will receive under this formula. My understanding is they came from the Department of Health.
It did, based on using state funding. Yes, sir. And there's a way to do it with ARPA, but the program and the statute is what designs the program. And we can, as I've been speaking, to individual legislators, just here's the problem. This is what we see as the fix, but it's above my pay grade.
Fix by statutory fix, amendment fix, or something else?
You will have to decide what funding sources you want to use, and then we can help you design the program. If you use state money, do as you please. If you want to use ARPA funds, then we can show you how to design that through statute to take care of everybody that doesn't receive funding. We don't know. I mean, and I'm also being told that we don't have control of how it rolls out. Once
we not give it to y'all, the rollout of it.
Yes, sir, but we don't control the ARPA funding. That's through DFA.
DFA does that.
Yeah, and of course we're relying heavily on our compliance groups at Horn and HRK. I will let y'all know there's a lot of appetite for clawbacks from the federal government right now, especially with ARPA funds. And the last thing we want to do is push that money out, and if we don't do it right, then have to pull it back. And believe me, Mr. Chairman, I'm extremely frustrated over this.
I want to make sure I understand. Are you telling us that the people you say, the hospitals that you say are qualified, are about to get the money, or is there going to have to be some action taken before that's even done?
There's a decision of whether to activate the program, which is ready to go, which means all the money has to roll out. We can't hold any of it back.
See, that's the issue right there, Dr. And that's
yes,
what
sir.
Trey's getting to. If we gave $103 million, and he's right, and as recently as a month or two afterwards, I contacted your office and it was 85% were going to qualify. And so this has been some administrative change that we were not aware of either during the session or shortly thereafter, which hadn't been that long ago, the last 3 or 4 months. So what I think Representative Lamar is getting to, of the $100 million, you had a third that qualified. Does that mean $33 million goes to them? You have a third that didn't even ask for the money.
Yes,
I don't know how we can help them. I mean, they got to file. And then you have a third that don't qualify.
Correct.
Are those equivalent to the dollars? For example, the third that qualify, Representative Lamar is on the right track here, so they'd get $33 million and get a check. So then we've got to come back legislative here in the next 2 months and do something that would allow the other 66 to be paid either under ARPA or some other
Correct.
structure. Is that correct?
It is.
Okay, so we can get out 33 million now.
No, we can get 103 million now.
So that's why I keep asking this. There's 103 million going to 1/3 of the hospitals.
Yes, sir.
So
Based on the statute.
effectively, you're cutting out 2/3 of the hospitals.
Yes, sir. Please understand, I'm not cutting anybody.
Right. Well, but effectively, how this works.
But
And I think that's where
the program is
Representative
cutting
Morris-
out the program is cutting out 2/3. Yes, sir. And
So
that's why
a third of the hospitals would get all of the money.
of this first round. Now, there's a way we can help you design a second program.
But I don't mean to interrupt. Is that happening or not? I'm getting totally mixed. Either we got to make a decision. Somebody
The decision is
make a
whether
decision.
to activate the program and 103 million go to 1/3 of the hospitals.
has that decision been made or not?
No, sir. That's where I'm needing help.
Who's making that decision?
Y'all need to make that decision. Leadership needs to. So I need to be given direction.
Are you going to wait till January?
No,
Or do
sir.
we need a special session?
No, sir.
what-
No, sir. I just need, and I was hoping to have the conversation not, in committee and then allow y'all to meet and decide what you want to do. The two choices are to halt the program and not send any funds out and fix it in January for all the hospitals, or to activate the program and based on the statute and the ARPA compliance, all the money has to roll out to those who qualify based on need. And we have some with a negative impact of 140 million, all the way down to negative impact of 850,000. But that 103 million has to roll out, based on the demonstrated need. Okay.
Yes, sir. And whether the program starts or not, I think really is a decision y'all make. And if it does not start out until January, possibly there's a legislative fix to that. I'm a part of the discussions, as is Representative Lamar, Briggs Hobson, many of our people, and that was that it be given across the board to these many hospitals,
Yes, sir.
and that it wouldn't be allocated just to several. Now, the fact that you're telling us now that there are great losses in some, and somebody didn't have any losses, those are calculated by ARPA. They're not like real other losses, which are financial losses, which everybody suffered. Is that correct?
Yes, sir.
Right. So
Yes, sir.
when we go through this, every hospital suffered a lot.
They
And
did.
So that's why I think Representative Lamar's on the right track about the fact that we had allocations that the hospitals were going to receive, which were in some cases may even allow them to stay open. And we're 3 months into this, and you have a question now on the interpretation of that program. So you're looking to the leadership of the committees and the chairman,
Yes.
the speaker, and the lieutenant governor to give you guidance as to that, and the legislature to make whatever changes need to be made.
The decision now is, and if you give the decision to me, then I would recommend that we activate the program and get the money out, and then make it whole in January if that's what y'all desire. But I did not.
So you would be looking at a deficit appropriation under the interpretation of the legislature.
No,
and
sir.
then-
No, sir.
So you'd give the 103 million out to the 1/3 of the hospitals, the full
Who
amount,
are eligible through the program.
and then the other 2/3 we just have to make up from some other money.
At your discretion, there are still ARPA funds available in other programs that have been fully utilized that
Yeah,
you could
we've
pull
asked
in.
the staff to come back with that number. So would you give us what those numbers are so that
I will.
Everybody can make an intelligent decision? Under this scenario, we can look at the ones we were told were going to be receiving X, and then the ones that received X minus something or didn't even apply one way or another. And they may not have applied, quite frankly, because you started discussing that they had to meet these ARPA requirements, so they didn't even fool with it. So I'm understanding that. If you could give us the number, if you distributed the 103 now, what would be the makeup number and how that would proceed? I think that'd be helpful to us. I don't want to belabor it other than that. I think Senator Hobson and Representative Lamar will have to get up in a minute. And we have Mims and I guess Brian on the other side.
Yes, sir. I had the opportunity to speak with Chairman Mims this week. I spoke with Senator Hobson this week, and I'm getting a variance of opinion of what to do. And the heartburn for me is I know activating the program as it stands is not what y'all intended.
Okay, well, that's understandable. I think we've covered that as much as we need to. If you'd give us what those numbers would be under this interpretive decision by the accountants, then that'll give us some leeway into which we can make an intelligent decision. Yes, sir, Senator Horn.